statin to reduce your cholesterol. I have one slide that's special for statin. So I will go there later after I give you a break. But let me finish this. Okay, I will talk about statin by itself. I will talk about antihypertensive by itself. Calcium channel blocker also one of your antihypertensive, right? Calcium channel blocker. If you still remember, the mnemonic is very nice drug. You still remember that mnemonic, right? For beta blocker. Very nice drug. Verapamil. This is your kawan. Nifedipine. Diltiazem. Cardizem. This one always in the past. When you see dipine, remember this is your calcium channel blocker. I also can use nifedipine in OB because I can use nifedipine to decrease the contraction of the uterus. Medication that can decrease contraction uterus, I call this tocolytic. So if you pregnant only 36 weeks, your heart rate is beautiful, why you already start like have contraction? As long as your heart rate, the baby heart rate normal, I will give you maybe nifedipine or other tocolytic to slow down the contraction. Hey, you only 36 weeks, I don't want you to deliver your baby yet. I want you delivery when 38 weeks because that's full term. 36 still preterm, right? So with nifedipine or other tocolytic, I slow down the contraction. Hopefully you can wait until 38. The reason why I don't want they born preterm, usually the morbidity and mortality 3 times, even 4 times, 3 to 4 times compared with normal, right? High risk to become sick and high risk death. So this nifedipine, I can also use for OB. In-flex patient, ATI patient said, hey, you have a patient who used nifedipine and now the leg edema. Of course, report to doctor. Does not make sense, right? It's calcium channel blocker. I want to reduce your BP. So if I give you this medication, why you have edema with your leg? That's not normal. Of course, I will report. What heart failure that usually can have edema at their leg? Right side. So don't forget those, right? The right side heart failure compared with the left side. Very easy. The left side is lung. Still remember? Pulmonary edema, SOP, sputum, whatever that lung, that's left side. But your right side, you have jugular vein distension, you have ascites, the patient has edema, extremity, and what? One more. Splenomegaly. Exit question. How to check edema? Pitting edema. I use my finger, right? Point, right? I have +1, +2, +3, and +4. Don't forget, this one 2 millimeter indentation, 4 millimeter, 6 and 8. They ask you this question in exit. And pray for them. Right now, they take exit number 2. 11 people. Right now, they are taking that. So pray that they are successful. Right? And this is one of the test questions that they got. Pitting edema. Use your finger. Alright? So calcium channel blocker. If you don't start memorize, it will be hard. But if you read again, hear again, finally you can remember. Moreover, if you write it down, say it out loud. Right? Because when you say it out loud, you can hear it. When you write it down, you can remember better. If you listen to Panoto again and again, but better if you not only listen, but you write it down. That will help a lot. Any questions so far? Okay, go take 10 minutes. Guarantee you will see that in Proctor, right? Statin. Earlier I already tell you the propranolol don't give to asthma. I already tell you calcium channel blocker. Oh, calcium channel blocker don't give it to the people that already have heart failure. Because it also can make the heart slower. So they already fell, you don't want to make it worse, right? So be careful, don't give it to people that already have heart problem. So now statin. Everybody has to know the statin very well, right? Statin, lomostatin, many different statins. Give it at night before they sleep, right? But now we cannot write this anymore because it's not approved by the board, right? But the meaning of this is give it before they sleep.
At bedtime? So what do we write instead of 8 now?
Bedtime.
Oh,
Before sleep.
Oh, dang.
Yeah. Usually the test will say which one that's not approved by the board, that one, not approved.
So what time do we put now?
Before sleep. At night time. Before sleep. Yeah. You have to write it down because some people do not know how to read. So everybody suffers because of that. HS. You cannot write QD anymore. You cannot write Q other day. You cannot write unit. You cannot write microgram like this. It has to be MCG. You cannot write OU, OD, OS. So don't write something that's not approved. But Q for hour is still okay. Right? PRN is still okay. PO is still okay. So some okay, but some no, including SS. Even this one, and you cannot use that. It's not approved by the board anymore because people can read it wrong. So if you want to write unit, you have to write unit. Even magnesium sulfate, you cannot write magnesium sulfate because not everybody know how to read. So they finally, rather than make error, just write it down. Magnesium sulfate, morphine sulfate. Right? So here, only statin, give it at night before they sleep. This is anti-lipid or anti-cholesterol. With that said, you have to always check their cholesterol level. Normal cholesterol under 200. Normal triglyceride under 150. HDL, good cholesterol, 40 to 60. H, heaven, good, 40 to 60. The higher, the better. But LDL is bad, low density lipoprotein. I want it under 100. You have to memorize this. Okay? You have to memorize. So if I give somebody statin, maybe once a month, doctor will order for lab value. Check the cholesterol. So you have to memorize. Under 200, under 150, 40 to 60, the higher the better. And then LDL is under 100. My mom is taller than me. Very healthy, praise the Lord. And then one day when somebody checked my blood, they congratulate me. I said, why you congratulate me? Oh, because your HDL 80. Very good, that's genetic. I said, thanks God, I will receive it. Hallelujah for that, right? So the higher, the better. Sometimes can be 80, the higher the better because this is a good cholesterol. Yes.
Is that
150 for triglyceride, under 150. And then the LDL is the bad one. Bad cholesterol.
Doctor, why are we only giving it at night?
It works better at night when you sleep, not when you're active. Many medication, if it make you sleepy, give it at night. But if it make you cannot sleep, give it in the morning, right? Like your levothyroxine for hypothyroidism, also Ritalin Adderall for ADHD. I give it in the morning, right? Also the one that osteoporosis medication, alendronate, right? Alendronate, that's always in the test also. Alendronate, I have to give it in the morning also. Okay, let me write for you. The one that in the morning, levothyroxine, because insomnia. Also your Adderall Ritalin, actually that's your methamphetamine for people that ADHD. But please don't forget this, alendronate, always in the test. So alendronate is medication for osteoporosis. Okay, for osteoporosis. So you have to give it in the morning and empty stomach. In the test they will say, what do you teach them after they take the medication? Sit down or stand up. Walking around, don't lay down, right? Because if you lay down, it irritates your GI. That's always in the test, yeah. Alendronate for osteoporosis, please take it in the morning. Empty stomach. Don't eat after that. Walking around, do not lay down. And the reason why levothyroxine and this Adderall Ritalin for ADHD, you give it in the morning because insomnia, they cannot sleep if you give it at night. But other medication that pam, diazepam, escitalopram, right? Those make sleepy, give it at night. So whatever pam, antidepressant, give it at night because sleepy. Come back here. I want you to focus to this one because you will see this in the test, right? So, this one always in the test. The test will say this. Your patient received statin. Which one that will concern you? If the patient complain muscle pain. So if they have something about muscle, report. Why? Because statin can cause rhabdomyolysis. Myo is muscle. Lysis is dissolve. Rhabdo is the abdomen. So statin can lysis dissolve the muscle of the abdomen. So you cannot do this. Oh, I know this is anti-cholesterol, Lipitor, Mefacor, Zocor. Usually the trade name ending with tor, right? So sometimes you think like this, maybe my cholesterol high. You don't even check your cholesterol, you don't even know your cholesterol, but you think, this is belong to my husband or belong to somebody, and then you take it without permission, without checking. If possible, actually you don't have a lot of fat. So I don't have fat to break, I will break your muscle. Right? And that's bad. That's bad. You want something break your fat but not break your muscle. So if the patient complain muscle, report to doctor. Guarantee you will see that in the test. So I really need you to memorize that. Do not mix with grapefruit. Always in the test. But this is the tricky part. Statin actually have 7 different classes. These 4 other that not famous, it's okay with grapefruit. Only these 3 that no grapefruit. Okay? So this Lipitor, Zocor, Mefacor, go and check what is the generic. Right? Orvastatin, lovastatin. So find, Google what is the generic. But only these 3 famous ones. Lipitor, Zocor, Mefacor is the one that cannot give with grapefruit because they interact. So I don't like that because I remember I see one FDI question, they give you other statin, it's okay with grapefruit. Only these 3, no grapefruit. But in nursing home, they don't want to risk. That's why in nursing home, usually they have orange juice, they have apple juice, they have water, they have milk, but they don't have grapefruit, right? Because some people can have problems. And don't forget, check the liver. So statin can affect the liver. When something can damage your liver, I call that hepatotoxic, right? And also I want to check the kidney also, kidney function. Just to make sure they can throw away the waste product. And you already know yesterday, what is the lab for kidney function? BUN, serum creatinine, creatinine clearance, right? So BUN, serum creatinine is the blood sample, and creatinine clearance is the 24-hour urine sample. Know all of this for statin. Select all the apply. Know everything about statin, right? Check the kidney function, check the liver, SGPT, SGOT, ALT, AST. I don't want any complaint about muscle. Don't give it with grapefruit, especially that 3 Lipitor, Zocor, Mefacor. Give it at night. And then always check the lab value, right? Usually once a month, doctor will tell you to check for cholesterol level. So statin, anti-cholesterol. And I can guarantee you, you will see that question in your doctor. Okay, any question? It's memorization, right? It's not really understanding, it's memorization. And then I already tell you Timolo, for glaucoma, monitor BP. And this is the one that I tell you. Your propranolol, one, antihypertensive, correct. Two, it calm down the patient, that's correct, propranolol. And don't forget inotropes, slower but stronger. So even though this is only olol, but you also need to listen to apical pulse, full 1 minute. Not only digoxin. Good? Yes. So you have antihypertensive, only 5. So you have to memorize. Olol, you already know, that's your beta blocker. Pril, that's your ACE inhibitor. So with pharm, some medication is easy if you remember the ending of the medication, but not all, right? This one, it can help. So pril, ACE inhibitor. Yesterday we just learned. I hope you still remember because it's only yesterday. ACE is an enzyme, right? ACE convert angiotensin number 1 become angiotensin number 2. When it become angiotensin number 2, vasoconstrict. When you vasoconstrict, your BP go up. Remember that? But now it's ACE inhibitor. So I inhibit you enzyme, you cannot make that blood vessel constrict. That's why this is anti-hypertensive. Agree? Let me explain because people that not here yesterday can be confusing. Yesterday we learned about there is chemical in our body that we call angiotensin. And then this angiotensin number 1 can become number 2 if I have this enzyme. Right? Angiotensin converting enzyme. So if I have this enzyme, then I can make angiotensin number 2. But this is the problem. If you have angiotensin number 2, it will cause vasoconstrict. Means your BP will go up. That's why I have medication pril. Pril is ACE inhibitor. So I inhibit this enzyme to work. I stop it so you cannot work. So you will not vasoconstrict. That's why ACE inhibitor is anti-hypertensive. Yes.
I'm sorry, it's just hard to read your writing right now.
That's why angiotensin number 1, number 2. Angiotensin. Your angiotensin number 1, if you have this enzyme, it will become angiotensin number 2. I don't like that because when you have angiotensin number 2, you become vasoconstrict, and when your blood vessel constrict, your BP will go up. I don't like that. That's why I inhibit. Inhibit means I stop, right? Correct?
Yes.
Inhibit means antagonist. So I stop. Hey, you cannot work. So you will not turn to number 2. That's why ACE inhibitor is your anti-hypertensive. We just talked about that yesterday. It word per word. You don't need to overthink things. What is the meaning of ACE inhibitor? To inhibit your enzyme. So it will not convert angiotensin. Right? So this A stands for angiotensin converting enzyme. Word per word. You don't even need to memorize. It already tells you enzyme that convert angiotensin. But now I inhibit. I stop it, so you cannot do your job. And that's the reason why it's antihypertensive. Alright? Do not overthinking. Just know that. That's it. That's enough. Right? It's memorization. If you still don't get it, just remember ACE inhibitor is your antihypertensive. That's it.
It's okay, my recording has prefix in Florida.
Because sometimes I see the student ask me questions detailed that you don't need to know. Right? Okay, continue. So pril, but you also have tan, losartan, valsartan, right? So the medication ending with tan. If they ask you what is this, what is the class, the class name ARB. ARB stands for angiotensin receptor blocker. Word per word. If they ask you how it works, to block the receptor of angiotensin. What is that? I don't care. I don't need to know. All I need to know, it will block the receptor for angiotensin. That's it. And actually, many of the name, it's so scary when you read it. It's like so intimidating because all that big giant word. But actually, it's a blessing because it tells you what it is, right? So you just calm down, read. Usually, it helps with the wording. It already tells you the answer. If they ask you mechanism, how it works, follow the name. Remember when we talk about thromboangitis obliterans. It's a blessing. Obliterans means occlusion, itis means inflammation, angio blood vessel, thrombus, that is blood clot. It already tells me the answer. Okay? Other antihypertensive, calcium channel blocker. We just talked about that. Very nice drug. And don't forget this one. You also have alpha adrenergic. So you have to memorize. There is no other way. If I ask you, give me your antihypertensive, without reading, without looking, you have to memorize. Olo, pril, tan, calcium channel blocker, alpha adrenergic. If you have beta blocker, you also have alpha, right? This is Latin for A. That's Latin for B. Alpha, omega. Alpha, omega, right? A and W, the last one. So this alpha adrenergic always in the test because ending with sosin. The test always asks you which one that you can use for BPH. BPH stands for benign prostate hypertrophy. So you can use sosin, tamsulosin. You can use this antihypertensive, but also you can use for benign prostate hypertrophy. What is hypertrophy means? Enlarged. Become bigger, but only one cell, it's enlarged. If I say hyperplasia, it become big, but many cells. But if I say hypertrophy, it's one cell become bigger. Right? So benign prostate hypertrophy, BPH. The trade name, Hitrin cardura. The generic ending with sosin. Also, I see this a lot in the past. Clonidine, catapres, hydralazine. So there is no other way, but you have to memorize. If you see the word clonidine, catapres, hydralazine, that's your alpha adrenergic. The class is alpha adrenergic. Okay. This is alpha, this is adrenergic. This is alpha, adrenergic. This is beta blocker. Oh, I read it.
We good.
Alright, so do your best memorize. Olo, pril, tan, ARB, right? And then your calcium channel blocker, very nice drug, alpha adrenergic. I can do it, you can do it. I'm older than you. Are you done with this? Okay, take a picture, memorize. It's already in your PowerPoint also. It's also in Panopto. Other thing that guarantee you will see in the test. Okay? Guarantee will be in your test. So this antihypertensive, not only antihypertensive, but also later you will learn anti-Parkinson, antipsychotic, antidepressant. These 4 big class of medication, they have the same adverse effect, right? If I take this medication, what can happen to the patient? 1, orthostatic hypotension. What does that mean? If I get up suddenly too fast, I can black out, right? So this medication, not only antihypertensive, they can have orthostatic hypotension. That means get up slowly, please. Your risk for fall. Your nursing intervention will be get up slowly. The patient risk for fall. Be careful. The test can be like this. Hey, doctor suspect orthostatic hypotension. Nurse, go and check. What should I do? Lay down, let me check your BP. And then sit down, I wait for 5 minutes, and then I check your BP. And then stand up, I have to be there, close to the patient, if not they can fall. So I tell them stand up, and then 5 minutes later, check the BP. If the BP different 20 to 30, orthostatic hypotension. Alright, so make sure you know. Lay down first, check the vital sign, and then tell them to sit down, but wait for 5 minutes, check the vital sign. And then when they stand up, right, this one sit down, when they stand up, you have to stand close to them because they can fall. Check the vital sign after 5 minutes. If different 20 to 30 millimeter mercury, that's a problem, right? Let's say when you lay down 140. Why when you sit down 110? We have problem. Why you stand up suddenly 80? No wonder you black out. Orthostatic hypotension. Number 2, very important. Anticholinergic effect. Every time you see the word anticholinergic, remember dry. So I give you something to make you hallucination tonight. Hopefully tonight when you're dreaming, right? You wake up dry. Right? What does that mean? Your saliva less. Your tear less. Your urine less. Okay? Very easy. Dry. Your saliva less. No wonder you complain right now. I have to give you sugarless gum, hot candy, ice chips. Everything can become a test question here. Everything I see the test before. Right? What is your patient teaching? Sugarless gum, hot candy, ice chip. Because they have dry mouth. And their tear less. No wonder they complain blood vision. No wonder they need eye drop. Right? No wonder they complain dry eye. If you understand this, you remember, you can answer that. And then the urine less, they don't pee. So where is the water inside their body? So they have bowel bladder retention. Means not only urine, but also they also constipated. Not diarrhea. Dry. I only remember that dry. I can answer the question, select all the apply. Right? And these 2 big things, not only antihypertensive, but also anti-Parkinson, antipsychotic, and antidepressant. But I see how students confused, because there is one question said, what medication that cause urinary retention? And so many students already, we never heard that before, we never learned that before. But actually critical thinking. I tell you dry. You cannot pee. You have bowel and bladder retention. Is this the same with urinary retention?
Yes.
So the answer, you should know. The medication that causes urinary retention can be this, can be this. Urinary retention. So when you study, it has to be 2 directions. You remember that, but if suddenly I ask you from here, you can answer the other side. two direction. And I can guarantee you, you will see many tests based on anticholinergic effect. Dry, 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 dry. If I take away the word dry, if I take away the word anti, if I only say cholinergic drug, that's the opposite, wet, 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 wet. Alright? So you have to read carefully, you don't just, Miss Ina said dry, 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 not for that part, right? So you have to read carefully. Anti-cholinergic, dry, 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 correct. But if I say only cholinergic,
My phone airdrop is on.
this is wet, wet, wet. So when I have patients with cystic fibrosis, I purposely give them cholinergic medication to make them sweat, because I need to do the sweat test, or other name is chloride test. After I make them sweat, I measure the salt that come out from their body. That's cholinergic. Okay? So in cholinergic, wet, wet, wet. But in anticholinergic, dry, dry, dry. Atropine sulfate is anticholinergic. So the test question will ask you this. Hey, somebody need to go to surgery. Why doctor give atropine sulfate? So they will not drooling during surgery on the surgery table, right? To prevent them drooling, right? So many times before surgery, we give them something to calm them down, right? But also something to make them not drooling, prevent drooling. So this atropine sulfate is anticholinergic effect. Dry, 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 dry. Okay? But we have to be careful. If this is patient that glaucoma, you cannot use atropine sulfate, because atropine sulfate also makes the pupil dilate. It makes the pupil dilate. The word for this, mydriatic. Mydriatic means it makes your pupil dilate. When your pupil dilate, your IOP will increase more. That's why people that glaucoma, contraindication, you cannot give them atropine sulfate. That's another test question. Right? If somebody already have glaucoma, make sure never ever give them atropine sulfate. And you also tell them, hey, every time you go to store, right? When you buy something, if you buy OTC medication, report to doctor. Because just in case your medication will cause pupil dilate, you become blind. Okay? You can see that question later in Proctor. Next week already practice A, right? Practice A. Correct? Not there? I think it's practice A. It's only practice. It's only practice. Okay, and I will help you also.
Next week.
Okay? Got that one? Speak positive. If you say mental breakdown, let it break. And down. Right? Okay? Done with this. I hope you understand, and this one you have to memorize. Right? The most important, dry, dry, dry. Automatic, you should know saliva, tear, and urine down. And then whatever they change the question, you still can answer the question because this is the concept. That's why we tell you do the focus review, because we want you to know the concept. But some of you, when I see your template focus review, some of you, you don't care. You just write poquito, poquito, nothing that will help you. So some students, the way you do your focus review, you hurt yourself. You don't even go and open the ATI book. You just write whatever. Then whatever you know is whatever you write, right? But if you really go to the book and you really pay attention, guarantee that will help you. Okay? So if I have patient that hypertensive, what is hypertensive mean? What is my BP? Still remember 140/90? if you check my blood pressure for one time only and 140/90, can you already tell me that I have hypertension? It has to be 3 times, right? 3 different times. And if you check the first time, why so high? I will do one more time, maybe the other hand, right? And don't check the blood pressure right away when they just come in, they still tired, they just drink coffee, they just from the patio, it's very hot. Let them calm down first before you check, right? Maybe because of that. And some people, every time they see you use your white jacket, they already scared, right? White coat. And then the vital sign go up. Every time they see you. Or the penis erection every time they see you. That's also exists. Okay, then not only I give them antihypertensive, please I distract your mind now. Not only I give them antihypertensive, can I give them diuretic? If somebody overload, I give them diuretic, right? Why people BP go up? Because their blood vessels have a lot of water. Correct? Have a lot of fluid there, that's why the BP up. Please understand the concept. If your vein full with blood, BP go up. But if your vein collapse, dehydration, that's shock already. Right? Just the same, your hose, if a lot of water, BP up. But if your hose, no water, BP down. Right? So know that. That's why when they have hypertension, I also will give them diuretic. Sometimes doctor only give diuretic. Sometimes doctor only give antihypertensive. Sometimes doctor give antihypertensive and diuretic together. It's okay. Right? So that's the test question. There is one test say, can you give it together or it has to be one by one? No, together is fine. No problem. Right? So now you have to memorize. There is the one that throw away potassium. Okay? Throw away potassium. And many of you already know your furosemide. But only know furosemide will not save you if this is select only apply. Correct? That's why you still have to know there is other diuretic, especially Bumex, bumetanide, always in the test. Bumetanide. Ending with mite, that's easy. Furosemide, torsemide, mite, right? And then also ethaclinic acid, ethaclinic. Don't throw away potassium. With that said, what should you monitor? Hypokalemia. Please, you have to know the implication. It throw away your potassium. With that said, you have to monitor hypokalemia. What diet you have to give them? Potassium diet. Right? Because they throw away potassium, you have to check hypokalemia. And you need to give them potassium diet. Now the test question. Why I cannot give digoxin together with diuretic? Furosemide. Why I don't give it together? Miss Tony. Why I do not give together my furosemide with digoxin? Luisa? Why I do not give digoxin together with diuretic? Because write it down. When you hypokalemia, toxic. When you hypokalemia and you give digoxin, they will be toxic. Write it down. You will see that in the text. You have to believe me. When I say write it down, you better write it down and study. Mark that, right? You do not give digoxin together with furosemide because this one will cause hypokalemia. When you hypokalemia and you give digoxin, they will be toxic. Nausea, vomiting, diarrhea. GI problem. Yellow eye, hollow vision. When they're toxic with digoxin, they will complain. Yellow vision, hollow vision, and GI problem. Nausea, vomiting, diarrhea. Nausea, vomiting, diarrhea. Many medication, when the toxicity, usually GI problem. So if you go to Inquest or your doctor, and then you don't know the medication, but they ask you what is the sign and symptom of toxicity, usually nausea, vomiting, diarrhea. Nausea, vomiting, diarrhea. That's the most common side effect, the toxicity sign and symptom. Okay? Also know this, thiazide. The famous one, hydrochlorothiazide. Hydrochlorothiazide. Right? Usually in the test they just write like that. So know that this thiazide also throw away potassium. Right? Same thing like your furosemide also throw potassium. Means monitor hypokalemia. Give them diet potassium. So your thiazide, the number 3 and your number 1, they throw away potassium. Monitor for hypokalemia. So my question can be select all the apply. And my question can be which one that will throw away potassium. So you have to know my hydrochlorothiazide, my furosemide, and my bumetanide, right? So you have to know, throw away potassium. But if I ask you the opposite, which one that potassium sparing? So potassium sparing means I hold your potassium, don't go away, right? So this is potassium sparing. And now the opposite. Because you are potassium sparing, you have to monitor for hyperkalemia. You have to avoid diet potassium. And you already know, if they hyperkalemia, what is the medication again that I tell you? Please remember this, it's always in English. We just learned yesterday. What is the medication for hyperkalemia? Yesterday you can answer me. Come on, answer me again. Yesterday I remember. What is the medication for hyperkalemia? We just learned yesterday. Ladies and gentlemen, polystyrene sulfonate. Polystyrene sulfonate plus insulin plus D5W. OMG. I really suggest you write it down, post it in a mirror or something. Every day you can see that. Because this always in English. Every time the student come back, Miss Ina, you are right. I got that question. Polystyrene sulfonate, pheochromocytoma. I said, I tell you so, but I don't remember. Then don't tell me now. I repeat so many times and you still don't remember. Somebody still ask what is that for. What is polystyrene sulfonate for? Hyperkalemia. Hyperkalemia. It will the polystyrene sulfonate will bind potassium and throw it to the stool. The insulin and D5W will kick the potassium go back to the cell. Because where your potassium live? Inside the cell. Come on guys. If the medication is tequila, you remember. But polystyrene sulfonate, you don't care. Alright? So now, okay, back before I give you another break. So you have to memorize. My potassium sparing is the aldactone spironolactone. But if only know that, it will not save you. Because you also have to know triamterene and amiloride. Okay? Triamterene and amiloride. So you really have to memorize. Right? Triamterene, amiloride, my spironolactone, aldactone, potassium sparing. How can you memorize if you don't say it out loud and until you remember? That's the way to study. If you can make mnemonic, that can help you. Mnemonic really helpful, but not everything have mnemonic. Okay? So if suddenly somebody asks you, what is the potassium sparing, aldactone, spironolactone, triamterene, amiloride? You have to be able to say like that. Right? Which one that throw away your potassium? Furosemide, whatever ending with might. Also my hydrochlorothiazide. So you need to know those. If you know those really well, so when you take the test, you know the answer. You don't change your question. You don't change your answer. The reason why you change your answer, you don't remember. Right? You don't remember, that's why you change your answer. So I already tell you, this one will be in the test, right? One, monitor hypokalemia. This one, monitor hyperkalemia. One more thing, osmotic diuretic. Osmotic actually means hypertonic, right? So mannitol and Diamox, I want you to remember this. Mannitol will increase blood sugar. So if somebody blood sugar already high, don't give them mannitol, right? And this mannitol Diamox is the very best diuretic for edema. So if somebody has cerebral edema, pulmonary edema, so all edema, it's good to use this osmotic diuretic because they pull water out. They are hypertonic, that's why they pull water out. So if somebody edema, okay, let me ask you, when you edema, where is the water? Is that inside the cell or in between the cell or inside the blood vessel? Don't make me cry here. When you swallow, when somebody has lymphedema, where is the water? Interstitial. Oh, yeah. Who's that interstitial? No? Interstitial, in between the cell. In between the cell. Not inside the cell, not inside the vascular, not inside the blood vessel, but in between the cell. When somebody edema. So when the edema, we prefer to use this because it's hypertonic, it will pull the water out. But be careful, mana means sugar. Mana, right? So if your patient sugar already high, don't give them this. And remember, Diamox is sulfa. What does that mean? If your patient allergic to sulfa, you cannot give them Diamox. And the generic for Diamox is acetazolamide. Acetazolamide. That's why from tough, because sometimes the test will suddenly, okay, I give the patient acetazolamide. And now what is the adverse effect? Something like that. So either you know the medication or you don't know. If you don't know, then you just count your button. Make sure you wear something with button. A, B, C. Right? Either you know it or you don't know it. Okay? Mana, careful with sugar. Diamox, careful, sulfa. Every time when you see medication and start with the word sulfa, make sure they're not allergic to sulfa. Easy, right? Do you know that furosemide is sulfa? If you don't know, write it down now. This furosemide is sulfa. If you take furosemide for long term, you can have. That's a test question. Write it down. If you take aspirin also, right? Aspirin or furosemide, long term, you can have tinnitus. What does tinnitus means? Ringing in the ear. Why you answer all that one? That's far away. Right? Tinnitus is ringing in the ear. Furosemide and aspirin can cause tinnitus. Why you don't give aspirin to your baby? Reyes syndrome. Reyes syndrome means, what does Reyes syndrome mean? Their brain damage. They become impaired cognitive. Right? But when I will compromise, when I will give the child or the baby aspirin, when? You already learned this in cardio. When I will compromise to give aspirin to the child, juvenile. What is RS stand for? What? Rheumatoid arthritis. Juvenile rheumatoid arthritis. Juvenile for the child and rheumatic.
Oh, I guess I'm I would say you wrong.
Viral infection. What is your viral infection? Is measles viral? Is chickenpox viral? Is RSV viral? Is HPV viral? Sometimes in your practice A, it's so easy, right? It asks you antiviral. And then they ask you which one that will receive antiviral. And then here they say RSV. And so many students, they don't choose that one. V. What is V for? But sometimes you don't read, you're already scared. Oh my God, Mom, I'm gonna die. Then you die. Some of you, you not even start. You're already, oh, I'm gonna fail. Don't do that. When you self prophecy yourself, don't say that, right?
Yeah, can you
So sometimes it's not so easy. They already tell you RSV, respiratory syncytial virus, right? HPV, human papilloma virus, HIV virus. Okay, that's also part of your aspirin that you have to know. Alright? Any question for diuretic? Make sure you know your the one that throw away potassium and the one that holding potassium. Make sure you know your spironolactone aldactone, triamterene amiloride.
Well, we accept it.
I didn't get anything.
She got nothing to accept.
sushi. ¿Es lo que vas a querer tú?
We're missing his faces.
Okay? Let me add a little bit more before break. Okay, really quick because this one you already know, right? So, atrial fibrillation, no V wave, right? Remember this, I give them anticoagulant, you already know, heparin, coumadin, lofenox, fragmin. First question, how I give lofenox and fragmin? Subcute. What is the degree when I give subcute? 45. Can I give 90 degree if the patient fat? Yeah. So the person will say, hey, you have a patient with 350 pounds. Can I give IM? Yes. You pinch and then you give it. Don't release your pinch. You pinch the fat and then you give it. Right? So know that. That's your anticoagulant, right? I already told you about the antidote. Now anti-arrhythmic drug. Simple. What is anti-arrhythmic drug? To make irregular heart become regular. That's the first question. I saw the one that question asks you, what is that? To make the heart rate irregular become regular. And you have so many different anti-arrhythmic drugs. 1, 2, 3, 4, 5, a lot. Later you will see more, right? But the famous one, lidocaine, flecainamide, amiodarone, adenosine. I use adenosine for SVT, supraventricular tachycardia. But now you have to know digoxin very well. And digoxin is a very good medication, the best for AFib, A-flutter, and congestive heart failure. Okay, digoxin is the best for AFib, A-flutter, congestive heart failure. And then I also can do cardioversion. That's not far, but we already learned that in MedSearch, right? So now you concentrate for the farm. Later I will show you everything that you have to know related to digoxin. But do your best memorize. Lidocaine, flecainamide. Lidocaine can be also anesthetic topical. If I want to do the surgery, I will cut your skin, I give you lidocaine first, right? So the same medication can be anti-arrhythmic, can be also anesthetic. Okay, so now your adenosine for SVT means the heart very, very fast, but the problem not ventricle, but above the ventricle. So actually the problem is the atrium, not the ventricle. And there's one more page here that related. Right? That one is atrial flutter. I give them anti-arrhythmic, digoxin is the best, cardioversion, ablation. This is VTEC, this is VFib, they need CPR. Not far. Any question? Go take 10-minute break. You have to know digoxin very well. Guarantee you will see this in the class. Okay? And you have to know everything related to digoxin. So digoxin is digitalis. Okay? The class is digitalis. So the class is digitalis. The other name for digoxin is lanoxin. Lanoxin. Antidote, Digivite, immune fab. Immune fab. Okay? Digivite, immune fab. Lab value 0.5 to 2. You have to memorize. NG per year. You have to memorize. I always have to check the lab value because if it's too low, not working. If it's too high, toxic. So digitalis is there. You cannot eat double. So if the patient said, oh, I'm vomiting, maybe I vomit my medication. Can I take another one? No. Should I give another one? No. You cannot give double. And I already mentioned you cannot give with diuretic, especially the furosemide. Do not give with diuretic that throw away potassium because when they hypokalemia, that's when they easily toxic. Again, I already tell you GI problem, nausea, vomiting, diarrhea, know the yellow vision and halo vision. You can see this in the test. Yellow and halo vision can happen when toxicity. English question. A mom bring a baby and the baby on digoxin. Remember, digoxin is not only for adult, right? Some baby they born and they have the cardio problem. Yes, Tony? Yes. Okay. Right? So they, and then the test said, when you see the baby already fontanelle sunken, skin turgor really bad, already dry, the tear, no more tear, and everything already dry, mucous membrane already dry. What does that mean? The mom tell you, my baby vomiting, diarrhea. And in the beginning of the sentence, the test question, it says the baby on digoxin. So why they tell you digoxin? Must be connection. That baby toxicity with digoxin. Because when toxicity, nausea, vomiting, diarrhea. So you have to use critical thinking. Impossible you tell me digoxin for nothing. Why you tell me that this baby on digoxin? And now why you tell me when I assess why this baby so dehydrated? So the answer, because that baby toxicity with digoxin, nausea, vomiting, diarrhea, and now already very dehydrated. Alright? So the best, digoxin is very good for AFib, air flutter, and congestive heart failure. Okay? Digoxin is one of your anti-arrhythmic drug, right? To make the medication, to make the heart irregular become regular. So it's one of your anti-arrhythmic drug. Means it can make the irregular heart rate become regular. In your test question, I ask you, hey, what is AFib? It's irregular. And there is no P wave. It's irregular, that's why anti-arrhythmics digoxin is good. And do not forget inotrope effect. Again, this is negative and this is positive. I love stronger, but I have to be careful with bradycardia. Slower means bradycardia. That's why I have to listen to apical pulse full 1 minute. Now test question. The patient go home, discharged from hospital, and the patient on digoxin. Can I tell the patient check the apical pulse or radial pulse? The answer is radial pulse. Why not apical pulse? They don't have stethoscope. Correct? Because the question said the patient go home. This is not in hospital, this is not in nursing home. This is not you nurse. If you are the nurse, you have to count apical pulse. But when the patient go home, you teach them radial pulse. Because radial pulse, they by touch, they count. They don't have the stethoscope. Can you go apical pulse, just touch and count? Critical thinking. Right? Another test question that's similar like that. Patient go home, this is also discharge home. And the patient has G2. Can I teach them if it's clogging, use Coca-Cola? No. Use Sprite. Yes, that's correct, because it's home health, because at home, it's easy for them to find Coke. But is that for you? Can you use Coke in hospital, nursing home? No, you cannot. Too bad. Right? So you have to prevent, that's why you have to flush before and after medication to prevent clogging. Because once clogging, you cannot use Coca-Cola. That's for your patient when they go home. Right? Same thing with radial pulse, not apical pulse if they go home. Right? So if less than 60 for adult, hold it. If infant or children, pediatric, right? Less than 100, hold it. So now all of this for digoxin. Select all the apply. So you have to know your digoxin very well. You have to know your statin very well. And you have to study from today, because if you wait last minute before the quiz, not enough. Next Friday, your quiz. Whatever that you learn today, it will be in your quiz. Especially what I already make it easy for you, I already summarize for you, and in front of those you will see in the test. Any question for digoxin?
Yes, where's that inotropy? It says slower and then it says stronger. Is that stronger heartbeat?
Yeah. Your heart stronger and slower. That's why bradycardia. That's a heartbeat. That's why you listen to the apical pulse. Any other question? Okay, so that's very important medication. I think there is one more that my handwriting. Okay, so the anti-arrhythmic drug. There is so many class, right? Earlier, I already give you the summary, the one that lidocaine, flecainamide, amiodarone, adenosine, digoxin. But completely, this class is a big class. Okay, this class is a big class. So I already tell you what is the meaning of anti-arrhythmic drug, to make your irregular heart rate become regular. So whatever medication that can make your heart rate become regular, I put under this big giant class. And surprise, many of your antihypertensive also anti-arrhythmic. So you have class number 1, you have class number 2, you have class number 3, and you have class number 4. Anti-arrhythmic. Class number 1, disopyramide, procainamide, quinidine. Right? Earlier in my summary for you, I mentioned procainamide. So this procainamide actually number 1. Class number 1. How they work? They lengthen the refractory period, they decrease cardiac excitability. So not too excited. The heart not too excited, so they decrease the excitement. Refractory means the rest period, so they lengthen. Right? So hopefully they will not ask you until so detailed, but this is how class number 1 working. Right? Usually they only ask you the medication and the class. You just know that that's your anti-arrhythmic, right? Class number 2, look, olol, beta blocker. So my antihypertensive olol, but it's also anti-arrhythmic class number 2, right? Esmolol, propranolol, all the olol. How they work? They reduce the sympathetic excitement, excitation. Once you see the word sympathetic, remember vital sign go up. That's the easy way, right? If you see the word sympathetic, that means it makes your vital sign go up. And then you have class number 3. Class number 3 is your amiodarone. And how it works, it lengthens the time it takes for one cell to fire and recover. Not important, just know, right? But know the amiodarone is one of your anti-arrhythmic. And number 4 is your verapamil. Who remember what is verapamil? Calcium channel blocker. Good job, right? Calcium channel blocker. Very nice drug. Very nice drug. Verapamil kalan. Right? So that antihypertensive, but it's also anti-arrhythmic, class number 4. And how it works, it blocks the calcium. No wonder I call that calcium channel blocker. It blocks the calcium to enter the heart, and it will prolong the resting phase. So it answers from the name calcium channel blocker. It blocks the calcium channel. It closes the door for calcium. Don't come in. You are not welcome, calcium. Okay? So anti-arrhythmic drug, class number 1, number 2, number 3, and number 4. I never see the question that asks you what is number 1, what is class number 2, right? But just know the name. That's why I already make the summary for you. Lidocaine, flecanomide, amiodarone, right? Because you will see that in the next slide. Summary that I make for you, right? You have class number 1, class number 2, class number 3, class number 4, right? And actually there is a sodium blocker, beta blocker, potassium blocker, and then you have calcium channel blocker. And the miscellaneous here also under antiarrhythmic, adenosine. Earlier I write for you that adenosine is very good for SVT, supraventricular tachycardia, right? And sometimes some patients need electrolyte supplement, depend on their lab. If they don't have enough potassium, maybe I give them supplement, magnesium or potassium. What is your normal lab value for magnesium? Come on, lab value, magnesium. When you will start memorize? When you will start memorize? Okay, you really have to memorize.
1.5 something, I think.
Okay, you really have to start memorize. Memorize lab value. You have to. There is no choice. Okay, look at this. Sodium 135, 145. Fluoride 95.05. I will tell you from MedSearch in the beginning. Put magnesium, phosphate, and potassium in one row. Make your life easy. Then you can write it like that, 1.5, 2.5, 3.5. Then you will not forget every time when I ask you magnesium. You should know that one already, right? So if somebody magnesium 3.2, don't even MOM, magnesium milk, magnesia, because the magnesium already high. You have to memorize. There is question in Excel only lab value. You don't know it, gone. And you certainly do not want fail because 71.1. Passing grade 71.3. Right? Only one simple question like that can make difference. RBC, you already know 5 million, white blood cell 5,000, 10,000, thrombocyte 150,000, 450,000. Until yesterday when we do the quiz, not everybody remember the lab. So I give you time now to do it, right? UN 10 to 20, serum creatinine 0.6 to 1.35, the same number with lithium. You memorize together. And we learned that yesterday, creatinine clearance 125, 132. Albumin, easy. The same with potassium, 3.5 to 5. Protein, memorize, 6.2 to 8. So the test question said, hey, somebody need wound healing. Which one that concern you? If the protein only 4.2, oh my God, 4.2, that's abnormal. Normal should be 6.2 to 8. But if you don't memorize, you don't know. Okay? So memorize. And for wound healing, you need protein. You need zinc and you need vitamin C for wound healing. Calcium 8.6 to 10 if milligram per dl. But if they trick you, they change the unit to milli equivalent per dl, it only half, 4.5 to 5. So remember, they do this only for calcium. Somehow for calcium there is 2 different units. They don't really do that for other electrolyte. Okay, so you have to remember, if I use milli equivalent per dl, it's only half. So if you tell me that the patient calcium 6.2 but milli equivalent, too high. But if you tell me that the patient have 6.2 milligram per DL, too low. So if you don't know this, you got prick. Okay? So if you tell me your patient 6.2 milliequivalent, your patient too much calcium, hypercalcemia, because milliequivalent. But if you use the other unit, it's actually hypocalcemia. The sign and symptom will be different. And then in your heart, you do have ANP, BNP, CNP. Don't forget the BNP is the one that tell me your congestive heart failure, good or bad, right? I will check your B natriopeptide. You have A, B, and CMP is different. CMP is your CAM7, that's your basic panel, right? That's CAM7 different. But if I want to know your heart failure bad or good, I will check your BNP. And we just learned yesterday, aminoglycoside, mycin, ototoxic and nephrotoxic, right? Ototoxic, death, nephrotoxic, kidney. That's why always check BUN, serum creatinine, creatinine clearance. 10 to 20, 0.6 to 1.35, 125 to 132. And peak and drop. If I want to check your peak, I take the specimen 30 to 60 minutes after I give you medication, because I want to know the peak, the highest. But if I want to check the trough, before the next dose. Trough for mycin, ototoxic and nephrotoxic. Okay? Ototoxic and nephrotoxic. If I don't check, I don't know if you still have it in your blood, high or not. If I give it, it can go really high. That's when they got ototoxic and nephrotoxic. Please memorize your lab value. How many times I said it? Thiazide, sulfonamide, sulfa. I don't want allergic sulfa. We talk about loop diuretic and potassium sparing. How they work? They make you pee, right? Sodium and water loss. So when you pee, the potassium out, but the sodium also out. So hopefully when you pee a lot, hopefully your BP can go down, right? So lowering the tone and rigidity of the artery. We already know you have beta blocker, you have the one that adrenergic, alpha, right, or central. And then you have the one that peripheral adrenergic. Peripheral only means hand and feet. Central means in the middle, right? So you have central means the blood vessel that in the central area. The blood will relaxation and lower the BP. If I can make your blood vessel relax, I can make your blood vessel dilate, your BP can go down. And peripheral, that's the hand and feet, right? Limit the norepinephrine release, prevent vasoconstrict. I don't want vasoconstrict. When you vasoconstrict, your BP go up. I want you vasodilate, your blood pressure go down. So this tell you how alpha will work. It lower the peripheral, resistance and BP. Peripheral, hand and feet. And then combine alpha and beta adrenergic blocker. And then you have angiotensin, that's your ACE inhibitor. It inhibits your angiotensin converting enzyme, your ACE. So it's antagonist for your angiotensin. Vasodilator, dilate your blood vessel. And then calcium channel blocker, they block the channel of calcium. That's it. So you can give antihypertensive by itself, you can give diuretic by itself, you can combine, no problema. My goal, I want your BP go down. So the test will say, how do you know the medication work? The BP go down, right? How do you know the diuretic working? They pee, right? So you need to know what is the function of the medication. Okay, so therapeutic goal, my goal is to reduce the BP to normal or near normal with few adverse effects. I want it go down, but of course not go down too low, right? And now medication for renal, because this chapter not only cardio but also renal medication. So for renal, know this one, anticholinergic, dry. Antispasmodic for spasm, right? So usually the patient said, really painful after the TURP, it's very painful because they have spasm. So I can give them antispasmodic. And then they also have alpha adrenergic agonist. This is the treatment for urinary incontinence. What is the meaning of urinary incontinence? They just pee, they cannot hold it, right? So I can give you something to dry while you pee a lot. Alpha adrenergic agonist, estrogen. Maybe some woman menopause and now it's so dry, that's why incontinent. So maybe you incontinent because not enough estrogen. If that's the case, I give you estrogen. Okay? Because some people lack of estrogen. Cholinergic agonist. Is this still the same with anticholinergic? Of course, it's still the same. Look at the word. This one, they use the word anti. This one, even though they don't use the word anti, right? But antagonist. It's still against antagonist. But if they say agonist, they work similar. Agonist is similar. But antagonist is the same with inhibitor. Same thing, inhibitor. Okay? So you do have medication that alpha adrenergic antagonist. So it's like block up. The opposite from alpha adrenergic. So if I say cholinergic agonist, it's similar like cholinergic. In the test, I only know that antispasmodic. If they have pain, give them antispasmodic because they have spasm, right? BPH. I already tell you that BPH, you can use alpha adrenergic, sosin. BPH. Can be hypertrophy or hyperplasia. If hyperplasia, they have many cells. And if they have pain, you can give bladder anesthetic. What is anesthetic means? If I give surgery to my patient, what I give anesthetic? So they numb, right? General anesthetic, they sleep. Local anesthetic, they numb. And then you have analgesic. We learned this. What is your analgesic for UTI? We just learned yesterday. What is the analgesic for UTI? That can make your urine reddish orange color. Oh. Notice, I will ask you in the test. So pyridium is the analgesic for UTI. It will make your urine reddish orange. What other medication also make your urine reddish orange? Rifampin for TB. Rifadipin for TB. Critical thinking. Do I need to tell them use protection to your underwear because your underwear will be dirty?
Yes. Right. Yes.
There you go. So they will not right away directly ask you reddish orange, but they can change the question still with the same concept, right? If you remember the concept, you can answer the question. Oh yeah, wear the diaper because if not, your underwear will be dirty. The rifampin, not only your urine reddish orange, your contact lens also become reddish orange. So your patient teaching, take off your contact lens. Because if not, it will be staining. The medication will make your contact lens also reddish orange color. Which one that I tell you yesterday? Your urine will be brown. Dilantin, phenytoin. That's anti-seizures. Dilantin, phenytoin. Your urine can be brown. Tell the patient before it happens so they will not freak out. What medication that will make your poop black? Iron. You have to know that iron too. Iron should be here also because that's something for cardio, right? So when I give you iron, the best is empty stomach. If not, you take with orange juice, vitamin C. If you need it urgent, C-track. Okay, C-track. Because take the spinach or all the diet take time. It cannot right away, right? If the patient emergency, the iron very low, C-track. Why you give iron to women that give birth? They just lost their blood 300, 350, so they need iron to build new RBC. And iron also stain the tooth, right? So usually for the baby, we put in the syringe and then we give it. Usually if children or adult, we tell them to rinse the mouth because it's make the teeth staining. What other medication that also stain your tooth, but you cannot give to pregnant woman and you cannot give to children under 8 years old? Good job. Tetracycline. Tetracycline. Do not give it to pregnant woman. Do not give it to the children under 8 years old because it stains their tooth. Not good for their bone and muscle. That's tetracycline. Okay, so don't forget your pyridium. Pyridium is analgesic. How do I know your analgesic working? Less burning, right? Less burning, that's the answer. Less dysuria. So pyridium is your analgesic. How do I know your analgesic work? The pain when they pee, less. What is overactive bladder? Usually they sing the song, got to go, got to go. And then you see somebody, run! Where is this one? Not it come back. It's long time. There they go. Alright, so for overactive bladder, remember antispasmodic. Antispasmodic. Somebody, I want you to Google now. What is betamecol? Betamecol. Urecolin. Check, what is this? Is this for urinary retention or the opposite? Google, what is betamecol for? Is that antispasmodic or what?
It increases urination.
Increase urination, so it's for people that have urinary retention. Betamecol. Treatment for what? What is the disease? What is the treatment? Treatment for what? Just read what you Google. What is the medication for? To treat urinary retention. This one in the proper they will ask you. For urinary retention. That means this is the bladder, somehow they cannot pee. So it's here. If they have urinary retention, is that mean they also risk for UTI? Yes. Because the bacteria will be accumulated. Okay? So please know betamecol, urecolin for urinary retention. If they cannot pee, give them that. But is betamecol diuretic? No, it's not. Okay? You already learned diuretic. Diuretic only the one that from potassium or potassium sparing, right? Betamecol not diuretic. It do not make you more urine, but it will treat the urinary retention. And this one, word for word, if they have spasm, they have pain, I can give them antispasmodic. Improve the symptom, it will reduce incontinence by decreasing the muscle spasm. So look like they incontinent because of the muscle spasm. So I give them antispasmodic for overactive bladder. So if they have BP high, I tell them change your lifestyle, reduce your weight, exercise, eat healthy food, vegetables and fruit, stay away from fat diet, right? What else that you tell people that have hypertension? Maintain your blood pressure, go to doctor, no alcohol, no tequila, stop smoking, you don't want stress life, no ATI, no pharmacology. Right? So change the lifestyle. Is that mean modifiable? Yeah. And then stage number 2, if the patient already tried, I already eat healthy, I already lost my weight, why I still have BP high? Okay, then doctor will give you medication. Either oral, tan, and also give you diuretic. Okay, so make sure, remember the adverse effect. What did I tell you? The adverse effect of antipsychotic, antidepressant, antihypertensive, and anti-Parkinson. What is the 2 problem? Orthostatic hypotension and anticholinergic effect, dry. Okay, so make sure you remember that will be in the test. So every time farm, you have to know what is the big class, what is the medication under that. Example, anticoagulant. What is the medication under that? Heparin, Coumadin, Clofenox, Fractin. And then what is special about those? Heparin, protamine sulfate, PTT. Warfarin, PT, INR, green leafy vegetables. So you have to know big and then small. That's why it's tough, because sometimes the same class, different story for each medication. They're unique. And that's why you need to practice many test questions, right? Because then sometimes something new you can see in the test, right? Know the specific, know also the interaction. Usually for interaction, we don't want to mix our medication with antacid. So usually don't give anything together with antacid, because antacid will neutralize everything, right? Antacid. Usually we don't want to give together with MAOI. Later you will learn MAOI is antidepressant, right? Antidepressant, but you cannot mix with MAOI, too much problema. Usually you don't want to together with birth control. Like some antibiotic, this is ABT antibiotic. Some antibiotic will mess up your birth control. That's why there is one test question said, when you give this antibiotic, you have to teach the patient use condom, because your birth control not working because of this antibiotic, you can become pregnant, right? So sometimes it can mess up. And then don't forget, if you use birth control, be careful blood clot. That's number 1 problem. Your weight can increase, you can have pimples. But the number 1 problem, careful with blood clot. So that's why if you already have cardio problem, I have to be careful with birth control. And usually you will not also mix whatever medication with cimetidine. This is also GI medication. Okay? So usually whatever medication, don't give it together. Also digoxin. Why you want to give digoxin together with other medication? But once you get your license, you don't care, because when you go to nursing home, 10 tablets, they just crush together. Right? Who cares anymore about the interaction? And what is the correct way actually when you give the medication?
One by one.
One by one, because sometimes the patient said, I don't want this, I don't want this. So you have to know the medication. Sometimes the patient asks you, right? What is this medication for? Just take it. Right? There is one time, not in this school, in other school, right? So the teacher prepare the medication together with student. The bad thing, the teacher do not go walk together with the student. So this student bring the medication, but she is confused. So she don't know, what room number again is this? Is this the one? And then she just go inside the room, and then there is somebody sit there. And then she said, the student, this is your medication. The patient already, the patient said, what is this for? I don't know, just take it. True story, right? I don't know, just take it. The patient take it, less than 1 hour, need CPR. Finally take to the ER, patient died. And the son, LAPD. Right away, the facility, we don't want to see students anymore. Get out from here. Since then, no student go to the facility anymore. That's terrible. Can you pay the death of somebody? Right? So what happened is, it's wrong patient. So actually when your patient said, nurse, my pill usually blue, why you give me pink? Oh, okay. Let me check. Don't give it. No better than you. Sometimes they will say, my medication usually bigger. Why this is small? Okay, let me double check. You don't want to make any mistake. But remember, I tell you, if the patient said, my O2 usually only 2 liters. Oh, maybe she is COPD, right? Because we know COPD only 2 to 3 liters. So for that case, don't say, let me check. Let me put down your O2 first, and then let me check. If wrong, then I will come back and put it up. But what if it's true? If I go and check first, they die. Right? Another nurse, floating. This is like, because we don't have enough nurse, then we call a floating nurse. And she floating but night shift. That's terrible. Because at night, right? There is one patient, we found the patient in the morning already died with the medication inside the mouth. So we asked this nurse, when you give the medication to this patient, is she still alive? And then she's like, oh my God. Are you telling me you crush the medication and you just put in the mouth and then you leave? Look like that. Because she doesn't even know if the patient's still alive or not when she gives the medication. That's terrible. And then she don't know, because floating, you don't know your patient well. She don't know that that patient is COPD. And she don't know that the patient have dysphagia, difficulty swallowing. If you want to give medication, the patient, you have to wake them up and sit down. You give medication, you have to check the mouth. So she don't know that this medication have weakness one side. And when we see the concentrator, it's 5 liters. So we said, you don't know this is COPD, should be only 2 liters. Just blank, she lost her license. Don't let that happen to you. It's so hard to get your license.
I heard it's not good, like, first 2 years to be a traveling nurse because of situations like that. Like, the hospital don't give you the full rundown and they just throw you in, and because you're a nurse.
Yeah. If you work in a good place, usually they will give you like orientation, maybe 5 days until you feel comfortable, confident, then they will let you go by yourself. But in bad facility, when they don't have enough nurse, sometimes they don't even give you orientation, they already let you go yourself. And don't work in the place that they pay you really high, but then they tell you, can you rewrite this nurse note? Can you write this? You're not even there, and then they ask you to write, right? You got it. It's not easy to get your license. What time now? 48. Alright, let me show you. We already talked about anti-lipid, right? The one that's satin. But look at this. Actually, the anti-lipid, you can see there is kilomicron. Means it's very, very small. VLDL, very low density lipoprotein. Lipo is lipid, the fat, protein, right? And very low density, so the density very low. And then you have LDL, low density. Remember earlier we said LDL is the bad cholesterol. It has to be under 100, right? So this low density breaks down from VLDL, linked with cholesterol and protein. That's what we call LDL. And then high density, why is a good cholesterol? Because it clears out the excess cholesterol from the tissue. So it actually helps you to make the cholesterol from tissue get out. That's why this is a good one. The other is bad. Okay? So this one for textbook, actually your statin, your anti-hyperlipid, you have 4 different lipoprotein, the size, right? This is the high density, low density, very low density, and very, very, very small. Like kilomicron, very small. Okay, but you just need to know HDL is the good cholesterol and LDL is the bad. So usually the medication, how it works? I want to increase my HDL and I want to decrease my LDL. Agree? That's the most important that you need to know. Because now you know LDL is bad, I want it lower, and HDL is good, I want it higher. Okay, and then there is other anti-hyperlipid, right? Many different name. The one that famous is the bile acid sequestrant, right? So there is many different things, but this one famous because bile acid sequestrant, it form in insoluble compound with the bile salt to reduce serum cholesterol level. Means it make you poop. This sentence means it make you poop. It form the insoluble compound. And this medication, right, combined with your bile to reduce your serum cholesterol because make you poop. To make you poop the lipid out. Niacin, you heard niacin before. What is niacin? What is this? It looks like omega-3, but I tell you something that you have to know about niacin. Anybody know? This is vitamin B number? What is B number 12? That one is cyanocobalamin. This is niacin. So far away. Right? Right? So niacin, just like omega-3, I tell you, if you take niacin, what can happen to your face? Which one that will cause Redman syndrome? That's your mycin. This one is flushing. Flushing is only your face. Only your face. Okay? By the way, for your proper form, you have to know. Redman syndrome, that's mycin. Aminoglycoside, the one that pick and drop. Right? But this niacin, flushing. Means the face very red. And niacin is good, effective to lower down your LDL and increase your HDL. Why omega-3 is good? Because it lowers your LDL, increase your HDL. Again, remember, LDL is bad, HDL is good. I want HDL go up, I want LDL go down. Okay, so your niacin, your omega-3. So why they say, oh, this is a good oil, use this oil. Because this oil can increase your HDL. Okay? Interaction, same thing, right? Just interaction, don't mix with other meds. Antihypertensive, we already learned, olo, pril, tan, we already talked about this, right? And I want the BP go down. Anti-anginal, the nitro, we already discussed, all the calcium channel blocker, we already talked about this. Nitro, we talked about this, right? And then there you go, if I give you nitro, possible, especially BP go down, because vasodilator. Okay, this is all nitro. So peripheral vasodilator, that's your sildenafil, right? Dilate the blood vessel. And then antiarrhythmic, we already talked about this. Other antiarrhythmic can be quinidine. Have you heard quinidine before? Where you hear quinidine before? Can I use quinidine for malaria? Usually I hear quinidine with hydrochloroquine, that's for malaria, right? So you can use the one that malaria, but actually it's medication also for antiarrhythmic to make your heart irregular become regular. And then you have breathilium, right? And how it works, disopyramide to make your slow down the depolarization. Depolarization is the contraction, right? So quinidine, propanamide, breathilium, disopyramide. At least know the name. So when you see, oh, I see this before, right? Lidocaine, adenosine, and olol. If I give you too much quinidine, you can have syncope. What is syncope? Fainted. Because of quinidine toxicity. Now they fainted. So this is the adverse effect, right? Most may cause other dysrhythmia. That's not fun. You have dysrhythmia, I give you medication anti-dysrhythmic, but the side effect, you can have other dysrhythmia. How many times you see in the TV, depression, eat this medication, but then side effect, they read really fast, suicidal. Do you pay attention, right? Somebody is suicidal, you give them medication, but the side effect of the medication, suicidal. And look at this synchronism, overdose with quinine. I usually can use that quinine for malaria and lupus. Lupus is the autoimmune disease, right? So I can use malaria and lupus, overdose synchronism. And that's, I think, the last one. Okay, very much. Cardiotonic, basically that's your
When I'm
digoxin,
happy.
right? That's your digoxin. So to make your heart become strong. But be careful, it can slow down the heart rate, bradycardia, right? So I can use your digoxin for congestive heart failure, atrial fibrillation, atrial flutter. So when you read this, you will notice that it's already covered, even though I don't go like detail, right?
Thank you.
Yeah. Toxicity, there you go, you need digibind, and done.